Psychedelics. Psychedelics remain controversial because they sit between medicine, spirituality, recreation, and criminal law. Drugs like LSD, psilocybin mushrooms, and Demeter's tea were heavily associated with counterculture movements in the 1960s, which led many governments to ban them. For decades, they were viewed mainly as dangerous substances linked to social instability and psychological risk. More recently, scientific research has reopened public debate. Some studies suggest psychedelics may help treat depression, PTSD, addiction, and end-of-life anxiety under controlled medical supervision. Supporters see them as powerful therapeutic tools, while critics worry about unpredictable psychological effects, unsafe recreational use, and the possibility of long-term mental health complications. Cannabis. Cannabis is controversial largely because public opinion changed dramatically over time. For much of the 20th century, it was treated as a serious illegal narcotic in many countries. Laws were strict, penalties were severe, and governments often described it as a gateway drug connected to crime or harder substances. At the same time, millions of people continued using it recreationally and medically. Today, some regions fully legalize cannabis while others still ban it completely. Advocates argue that it can relieve pain, anxiety, epilepsy symptoms, and chemotherapy side effects. Opponents focus on impaired driving, dependency risks, adolescent brain development, and concerns around commercialization. Opioids. Opioids became controversial because they exist at the center of both modern pain treatment and widespread addiction crises. Medications like oxycodone, morphine, and fentanyl are essential in hospitals and palliative care, where severe pain management can be life-changing. Problems emerged when prescription opioid use expanded rapidly in some countries during the late 20th and early 21st centuries. Overprescribing, aggressive pharmaceutical marketing, and illegal trafficking contributed to large numbers of overdoses and dependency cases. Debate continues over how to balance legitimate medical need with tighter regulation and public safety. Steroids. Anabolic steroids are controversial because they blur the line between medicine, appearance, and competitive advantage. Doctors prescribe them for hormone disorders and muscle-wasting illnesses, yet athletes and bodybuilders often use them illegally to increase strength and muscle growth. In professional sports, steroids became tied to cheating scandals that damaged reputations and records across multiple generations. Some people view steroid use as unfair enhancement that undermines competition, while others argue adults should have personal control over their own bodies. Health concerns, including heart strain and hormonal disruption, remain central to the debate. Ketamine. Ketamine is controversial because it has moved through very different worlds at once. It began as a medical anesthetic and remains widely used in surgery and emergency medicine. Later, it gained a reputation as a club drug because of its dissociative and hallucinogenic effects. In recent years, ketamine clinics have appeared in several countries offering treatment for depression and trauma-related conditions. Some psychiatrists consider it one of the most promising mental health breakthroughs in decades. Others worry that rapid commercialization may outpace long-term safety research, especially outside carefully controlled medical environments. Nicotine. Nicotine is controversial, partly because of how socially accepted it once was. Cigarettes were heavily advertised throughout much of the 20th century, often appearing in films, sports sponsorships, and everyday public life. Over time, however, research linked smoking to cancer, heart disease, and major respiratory illnesses. Today, debate extends beyond traditional cigarettes into vaping and nicotine alternatives. Some argue that e-cigarettes help smokers quit more dangerous tobacco products. Others worry that flavored vaping products attract younger users who might never have smoked otherwise. The controversy now involves public health, addiction, regulation, and corporate responsibility all at once. Performance enhancers. Performance-enhancing drugs remain controversial because they challenge ideas about fairness and human limits. Substances like steroids, blood boosters, and hormone treatments can dramatically improve athletic performance, recovery, and endurance. Some people believe enhancement is simply the next step in competitive evolution, especially when technology, nutrition, and training methods already provide advantages. Others argue that drug-assisted competition pressures athletes into dangerous choices and weakens the meaning of natural achievement. The debate becomes even more complicated when therapeutic medical exemptions enter professional sports. Psychoactive prescription drugs. Prescription medications that affect mood or behavior are controversial because they can both improve and complicate mental health treatment. Antidepressants, anti-anxiety medications, stimulants, and sleeping pills help millions of people function more normally in daily life. At the same time, critics question overprescribing, pharmaceutical influence, dependency risks, and long-term side effects. Some argue modern society relies too heavily on medication for emotional struggles that may also involve social or environmental causes. Others emphasize that these treatments can be essential, effective, and life-saving when responsibly managed.